Another question I get quite often as well is, what are the symptoms? What are the risks? What do you feel? How you cope? Or, what do you do? Do you have to take special precautions? Or, you know, simple answer. There's no simple answer. Um, because my blood factory isn't working properly, MDS comes with some very real daily symptoms, multiple daily symptoms. Okay. My biggest one is the severe body pains. Damn, those guys. You know, and it's specifically in my muscles, my joints, my bones. I can't explain it. It's inexplicable. Right now, I've got this, it's been nagging me for a few days now. This thing in my neck, but it's between my neck and my shoulder, but it hits me in my muscle. But when I press on my muscle, my shoulder hurts in the bone. I can't explain it to you. It's a weird thing. And at the same time, yesterday, I was I was walking, and the next minute, my knee just collapsed. Not my leg, just my knee. Feels like it just forgot how to operate. Didn't know it had to bend. And I felt this piercing pain, like a needle, going through my shin bone, going in and then getting pulled out. And the thing is, these pains, they move around any minute. It just, I'm feeling it now, and then it's in my knee, then it's in my toes, then it's in my head. It just moves all over the show. So that's one of the symptoms. For me, it's the big one. That's the pain is the big one. Okay. Another one I sometimes get, it's a skin irritation. For no reason, I'll get a little rash. I'll get a little bruise. It's inexplicable again. I've been feeling it mostly around my eyes. Around here, there's like a rough spot suddenly developed. And if I touch it, some days I just can't touch it. It's so sensitive. I just can't touch it. So I suppose that's one of the side effects as well. I'm not sure. I haven't heard of anybody having the same thing, but okay. That's the ones I'm feeling. Fatigue. Intense fatigue. At the moment, it hasn't been too bad. I'm not who I was. The fitness guru I was before. Not if I was a fitness guru, but yeah. Especially in the beginning when I started my treatment. Yeah, no. 3 steps was the max. You have to stop. Take a breath, then you can manage another 3 steps. But then when you stop for that one, you got to manage 3 breaths, not one. One doesn't cut it anymore. It's really severe. It drains you. It saps your energy. It really saps your energy. Shortness of breath, that's accompanied with the fatigue. I mean, that's all got to do with the same thing. Because in my mind, it's because my red cells can't carry the correct amount of oxygen to my bodies, to my body, to my muscles, to my organs. Yeah, I think that's the biggest thing. And this also means then I'm at a higher risk of infection because my white cells are also taking a hit. Like I said, the bruising and the bleeding, I've noticed that there's some extra bleeding nowadays, and from places I didn't normally bleed before, so it grabs your attention. Okay. The biggest risk of leaving MDS untreated for me, because I'm bringing this one up because I have mentioned this to my doctor various times. I've approached him and said, Doc, can we do this without doing the transplant? Can I maintain it with this the chemo that I'm on? Because the way I feel right now and what I see with what the journey is going forward, I can see the path. I mean, we're looking at 2 years minimum to reach some form of recovery. It's a long time, and I don't want to be put in that position, or I wouldn't like to be in that position. And he tells me, that's not how this works. The biggest risk of MDS, leaving it untreated, is that it can progress into acute myeloid leukemia. I definitely don't want that. AML is the next level, or the next step on this ladder of leukemia. This is a really aggressive form of blood cancer. And because of that risk, I've got to treat this seriously and aggressively, and that's what my doctors are doing. So when it comes to curing this disease, this MDS, the only thing, the chemotherapy and the meds help manage it. I mean, the meds I'm on, it's decitabine, Dacogen, and that stuff has actually stopped the progression. It's paused it. It hasn't stopped it. It's paused the progression. And I am where I was last year. I'm feeling more or less the same. All right, except for the pains and the obvious things that I've already mentioned, the fatigue and all those things. But if you catch me on a good day, and today, so far, this morning, things have been nice, except for this now pain that I've got here. But it's bearable. I also sound like a silly Susan just complaining about everything. It's not what I want to portray. I'm just giving you the facts as they're coming to me. If I leave this untreated, the chemo and the meds are not going to help. The only actual cure for MDS is a bone marrow stem cell transplant. And that's where we are heading. So once my donor has been approved, then that transplant will completely reset my system. Thank you very much. You guys are a real squad. My quadrilla. I love you guys a lot. God bless you all. Miguel signing out.